I'm a retiree, retired doctor, and I've read this bill pretty carefully. Congressman Klein supports the public option. The public option sets up the federal government of the United States in the health insurance.
Yes, he does.
H.R. 3200.
You heard the Congressman.
Did he vote for H.R. 3200?
Well, has not been no vote on
All right, I talked to Ron Klein personally, and he told me he supports the public option.
He just said that.
The public option. As a matter of fact, I've been in Washington several times, and I just saw Congressman Klein at the Florida Medical Association meeting. He supports the public option.
FMA, sir.
No, he did the invitation. I was there. I heard it. What I'm trying to say to you is that I talked to him personally, and I know he supports the public option. The public option sets up the federal government of the United States in the health insurance business and allows them to write the rules to write the private carriers out of business. It will turn all of us into government health care, socialized medicine. That's what it is. Total government monopoly health care is socialized medicine. Go look at Canada. Look at Great Britain. Look at France and look at Italy. You will see no doctors like myself. There are only 2 doctors per 1,000 people in Canada, 2.1 doctors per 1,000 people in Great Britain. The average Canadian has 40 to 50% less access to modern medical technologies like renal dialysis, CAT scans, MRIs. In Great Britain, it's even worse. It's 60 to 70% less access to medical technologies and care. Why? Because they have no money. Because socialized medicine outstrips its actual income from taxes. And this system of socialized medicine will run up, by CBO statistics, over $1 trillion in debt for our children and our grandchildren to have to pay off. Not only that, they intend paying for it by taking $500 billion out of Medicare money and shifting them into the public sector for the public health program, the government-sponsored program. That will strip Medicare. Not only that, they plan on having czarist agencies, just as they do. Great Britain has the National Institute of Clinical Excellence. They make the decision for the patient, not the doctor. The doctor and the patient is a ridiculous concept in Great Britain. The actual decisions are made by these committees, which don't care a darn about the patient. There's a lady walking around, and I'll make it brief. There's a lady walking around Great Britain named Debbie Hurst who has metastatic cancer of the breast. Her doctor wrote a prescription for Avastin chemotherapy. The chemotherapy is over $46,000. It's more like $100,000. So she went to fill the prescription to get her treatment through her oncologist, and they said no. They would not give her the drug. So she said, okay, I'll sell my house. I'll get the $100,000 that way, and I'll buy the drug and have it administered by my doctor. And they said, no. If you do that, we are going to charge you for all the treatment related to your breast surgery, chemo, and all the treatment that we've given you in the past, giving her a bill of over $200,000, which she could not afford. Now the lady is walking around, poor quality of life, the tumor is spreading and enlarging, and she's in pain all the time. There's another man named John Nuttall with a fracture of his ankle in Great Britain who was a construction worker. And they wouldn't operate on him. They denied him the surgery for his ankle fracture because he was a smoker.
Where's the AMA? Where do they stand? The
AMA set up originally, and that's a very good question.
Yes, I know.
And this occupied our time at the Florida.
Why aren't they demonstrating with us?
Let me explain what happens. Sold out. We regular doctors in the community, retirees and practicing physicians, read the AMA plan. It had a guaranteed access pool for those with chronic disease, and it had tax credits so that poorer people between income levels between Medicaid and $45,000 a year would be able to buy a decent health care policy with their tax credit money. And we also had many other features, such as tort reform, which would eliminate the defensive medicine practices, which cost our health care system $100,000. So what happened? My friend, who I thought was on the same page with me, Cecil Wilson, who's now going to be the president of the AMA, went into negotiations up there, and I asked him, what the heck did you do? You came out of there supporting H.R. 3200, which sets up the public option, which leads us to socialized medicine, which strips the elderly of $500 billion to shift it over into the public sector, and which will cause enormous taxation of working people. It's working people, people that make $30,000, $40,000, $50,000 a year, that are screwed in a socialized health system. The reason is they need tax money.
What was his answer?
His answer was there are some good points in there.
Is he going to be the new czar?
I don't know. That's a good question.
Where is the AMA headquarters?
Chicago.
Chicago.
Yeah.
Thank you. Thank you.
One question for Congressman Klein. Why in the world would he support, now would he support, the public option or socialized health care when we all know it is bad, not good? I don't understand that. It's bad for America. It's bad for the poor. Yeah, I already said
So we can treat the illegal immigrants and get more votes.
Okay. Thank you very much.